Good evening, ladies and gentlemen. Welcome to tonight's edition of Team Training Tuesday, also known as Applied Neolife. Today we are tackling the issue of eyes, and we're going to talk about the health of the eyes and how they impact our total health. My name is Esa Zanambasi. I am the hostess of this platform. I've been running it. I was actually checking, I think since 2021. So it's been quite a while. And by training, I am a medical doctor. I'm not an expert in the eyes, but we were taught something about eyes. So I chose some topics to discuss. And by passion, I love what we do in this family. So for the visitors who might be on the call, welcome. We love to have visitors to showcase what we do in our family, which is a family on a mission to make the world healthier and free of financial stress. And I'm sure you'll learn more about it. Right, we are talking about the eyes, and the eyes are the windows to your soul, famously said by William Shakespeare. So I want to focus mainly on nutrition and why it is so important to ensure adequate nutrition, particularly for eye health. So here are some random facts. The eye develops differently when nutrition is skewed. In other words, if nutrition is inadequate or if it is the wrong type, then the eye is affected. An eye that does not mature properly during the formative years obviously cannot function normally. And it's always astounding to see young children, age 4 or 5, with glasses. I always marvel at that. Then high intake of sugar leads to many people with visual problems. And we'll hear more about the effects of sugar. The area around the eye changes with poor diet and with allergies. It's a delicate skin that surrounds the eye. It may become dark, it may swell, it forms creases, and it can become puffy. So the eyes are very important diagnostic tools. And any doctor who does not look at the eyes well is actually not performing a full examination. And further to this, digestive problems often accompany allergies and eye problems. So, in short, the eyes are very, very important, but healthy eyes can be very beautiful. And to be healthy, they have to be constantly lubricated. Eyes provide an open doorway to view how efficiently the body is lubricating different tissues. If the eyes are dry, that tells a story. Or if they're nice, moist, and shiny, that also tells a story. Eyes have complex visual apparatus with specialized needs for nutrients to function properly and maintain a good state of health. So with that introduction, let us look at the eye itself. It looks something like that. This is just a diagrammatic representation, but one sees some important points that I want to point out, such as the presence of muscle to move the eye. And very often when we do these presentations, we talk about muscle and the importance of feeding the muscle and the fact that the cells of any tissue, but particularly muscle that work hard, have mitochondria. Those of you who were on the presentation last week might remember that we spent some time discussing mitochondria. But then importantly also is the fact that there is a lot of watery and fatty and proteinaceous content of the eye to hold the eyeball and to give it structure. And then in front, there is this portion here. So it's an intricate organ, but I want to point out one very important point, apart from the fact that the retina is where the pictures are imprinted. You can see this one is imprinted on the retina, and there is that central part that we'll discuss a bit later on. But this, the optic nerve, connects the eye directly to the brain. It might sound obvious, yeah, but if there is any sickness or disease from the eye, it has direct access to the brain. That's something important to remember. Let us always hope that we look after ourselves well, but yeah, accidents do occur. And so the eyes are the gateway to your health. In other words, research shows that an eye exam was the first healthcare test to detect some chronic conditions, such as high cholesterol and high blood pressure and diabetes. So that's what I meant by it's important to examine the eyes well. Now let's look at some symptoms of high cholesterol or dyslipidemia, as we call it. In other words, out of sorts lipids in the blood. The first one, we can go in any order, but xanthelasma, arcus senilis, or it can be not senilis, but juvenilis, juvenile. There's this one called a plaque, Hollenkost plaque, and then it can have retinal vein occlusion. The vein that supplies the retina might be occluded, very similar to how a deep vein thrombosis happens. So here, some explanations. Xanthelasma, that is actually cholesterol deposits underneath the skin around the eye or on the eyelids. Very many people seem to have those little blobs that appear around the eye. It is cholesterol deposits. Generally, they're not painful. They can be removed for cosmetic reasons, but they are often associated with hypercholesterolemia, which is hereditary, runs in the family, uncovered obviously by the environmental factors, or with certain liver diseases that can affect cholesterol metabolism. Cholesterol is made in the liver for the good uses, such as creating our hormones and impacting our immune system. So if it is out of balance, or it is the wrong type, or it is made out of too much processed carbohydrates, then it will be deposited. And then I mentioned arcus senilis. If one is under 50 years old, it might be called juvenilis, and that is where it is quite significant, because in the younger person, combined with a topic that we've discussed on several occasions, the metabolic syndrome, of which hyperlipidemia is a component, signifies the increased risk of cardiovascular disease. Now, you'll come across this quite often, that the eyes might be pointing to what is happening in the cardiovascular system, the heart and blood vessel system, a system that we have covered several times, and I'm sure we'll cover again. So it might be a telltale sign, those arcus senilis, which are round rings around the iris, because it just delays the making of a recording. Anyway, we shall carry on. So, eye conditions that can be due to lack of adequate nutrients. And I'm going to restrict this presentation to the first 5. That is cataracts, dry eye, floaters, night blindness, and macular degeneration. The last 3, such as puffiness, we've mentioned allergies and wrinkles and inflammation. Eye sensitivity due to bright light can happen. I'll mention it as we go along. And nystagmus, which is associated with alcoholism. We won't go into that, okay? But it is also an eye disorder where the eyes cannot stay still. They are shifting because of the neural damage. Right, let's start with cataract, very common. I'm sure each one of us know a relative or a friend who may have been diagnosed with cataract. A normal eye looks like that. It's nice and see-through. Light is allowed through the pupil right to the back of the eye, to the retina. But when there is a cataract, the lens is clouded. And so light comes and then it is splintered. It is sprayed, as it were. It isn't focused on the retina. So it becomes very difficult to create an image. And cataracts can lead to blindness. Their treatment is often surgical. That means removal of the natural eye. And these days, unlike the very olden days where one had to wear very, very thick glasses to replace the natural lens, these days they can replace the natural lens with a prosthetic lens, an artificial lens. Cataracts often are associated with diabetes. Now, in the past couple of weeks, we've talked a lot about diabetes and insulin resistance. Okay, so cataracts could be a telltale sign because there is an enzyme that converts glucose to sorbitol, which is a sugar alcohol associated with cataract formation. And cataracts that are found in people who don't have diabetes, they might be pre-diabetic though, but who are not confirmed diabetics, could also be due to oxidative damage, especially if there are low carotenoids in the diet, fruits and vegetables. And if you recall, I said I'm going to really mention why it is important for the sake of our eyes to focus on adequate nutrition and perhaps to consider supplementation. But before we get there, I want to emphasize the danger of sugar. Sugar is highly addictive and damaging, and it is found in foods that you might not even expect it to be found in. And these days, even some medications are laced with sugar because of that property of being highly addictive. So one has to be very careful to beware where sugar is coming from. If our children are to become healthy adults, and if we are to end the trend of chronic disease, I believe it is the responsibility of all parents to become stricter with eliminating sugar. I know it is easier said than done because peer pressure and the school systems seem to promote the use of all those sugars and sweet beverages. However, we need to try and encourage our children to eat naturally sweet foods, such as fruits and vegetables, because they are much better than highly processed foods. So the next condition I want to tackle is dry eye. And up front, as regards nutrition, it is a clear deficiency of omega-3, vitamin A, and zinc. And how many times do we talk about those three nutrients as being very, very important? So I hope this will be confirmation that if for nothing else, get yourself some omega-3, some vitamin A, and some zinc. Because lack of those, vitamin A and zinc, hinder secretion of mucus, causing dry eye. And it might also be an indication of an autoimmune disorder. And autoimmune disorders are many, many, and they're very many, and they're very fascinating in that they might have a common root cause, but manifest in so many different ways. And here's some interesting facts. Excessive levels of estrogen, including xenoestrogens, those are the outside and natural estrogens, actually switch the immune system on. In other words, the immune system tends to go into overdrive, and that can lead to autoimmunity. And then testosterone and progesterone, which tend to diminish with a lot of factors in the lifestyle, may be able to switch off the immune system. But now, if there's estrogen dominance, I've gone a little bit into hormones, then there would be problems, including to the eyes. So it is very important to be aware of proper hormonal balance. And these are the things one can do. Limit screen time. That is hard these days, but yes, we have to try. Have more time out of doors so that in addition to the sunshine that one is exposed to, you're not in front of a screen all the time. I think we need to really get back to those basics. Other things are hydration and making sure that the air is not too dry. Symptoms of dry eye syndrome: scratchy eyes, feeling like there's sand in the eyes. A lot of people complain about that. Burning and redness of the eye, the conjunctiva. Itchy eyes. Excessive tearing or watering of the eyes. Fluctuation in vision, especially if one uses the computer a lot. The vision might fluctuate. And then pain and tenderness. So dehydration is a big factor, and to get young people to drink or even older people to drink can be difficult because of lack of interest or loss of the sensation of thirst with the aging process. I just want to say, technology, guys, ladies and gentlemen, it actually causes a reduction in the protective film over our eyes. And that's where omega-3 supplementation would be very important. Okay, condition number 3, floaters. I used to have floaters, and I know why I had floaters, particularly in my left eye. That's because I, once upon a time in my 20s, had some surgery on my left eye. So for several months after that, in fact, for several years, I had floaters. I don't remember at what point they disappeared, but I suppose when I started supplementing over time, they've been dealt with. So I no longer have floaters, but yeah, floaters may be an early warning sign that nutrient intake is inadequate to build or maintain healthy eye tissue. If they happen suddenly and they increase, especially in one eye, and then there's a change in the vision in that eye, that may mean that the retina is loose or is becoming detached. A detached retina is an entity in itself. It's actually a disease condition, and it can lead to blindness. So floaters in a section of the eye might look like that. A lot of debris in the eye matter inside the eyeball. Very, very uncomfortable and distracting. Then the fourth one that we wanted to discuss, I think this is number 4, yes, is night blindness. Okay. In our eye, we have the rods at the ends of the retina and then the cones in the middle. The cones appreciate brightness and color and light. And then the rods on the outer rims are mainly supposed to be very sensitive to low-level light and work well when there's dimness or, yeah, very low light. So night blindness is when one cannot appreciate any light at all when it is dark, okay? So here are some notes on that word that is translated night blindness, nyctalopia, right? Night blindness. It may exist from birth, or it may be due to malnutrition, or in some cases, injury. It may also be due to severe nearsightedness, myopia, and other refractive errors such as farsightedness or astigmatism. And those ones, when they're refractive errors, they may be correctable with the appropriate prescription glasses. So yeah, some of us need to have prescription glasses, but night blindness could be made worse if those situations are available or happening in the person. But one of the commonest causes is vitamin A deficiency. There'll be an explanation a little later on, but you see, nutrition, again, in the health of the eye keeps coming up. So how to improve night vision? Get enough sleep, have a healthy diet, which should include nutritional supplements, basically because we know that to have a healthy diet in today's economy and society is very difficult because of the way food is produced. We can go organic, which would be excellent, but there are nutrition gaps in the diet. Avoid bright lights, and that can be quite damaging. And when you have been in very, very bright light, take some time to allow the eyes to adjust and see whether night vision will improve. Avoid exposure to tobacco, and if on chronic medications, please discuss them with the doctor with the view to reducing those that are not necessary. We've had a discussion here on polypharmacy, particularly in the elderly. That simply means that elderly people are put on too many medications, some of which clash and some of which may lead to vision problems. And then, of course, keep your glasses on hand, be aware of limitations, and regularly have checkups if you can. Then the fifth one, the big one, is age-related macular degeneration. And I just put some pictures here, but let us describe it. Macular degeneration is an eye disease that causes vision loss in the center of the field of vision. So it causes central visual loss. The key symptom may be blurred vision, and it comes in 2 types. There is dry age-related macular degeneration. They call it age-related because it tends to happen as one grows older. But dry macular degeneration is when the center of the retina deteriorates. For some reason, it's just deteriorates, and I strongly think it is because of nutrition. We'll see a little later on. And then wet macular degeneration is when there are leaky blood vessels that grow under the retina. There are blood vessels under the retina, but they might start leaking. And we have discussed cardiovascular diseases, and some of you might remember us mentioning scurvy. In the olden days when sailors used to stay on the seas for several months, and then they would develop bleeding of various tissues, the gums and all that. I suspect this is an indication of a form of scurvy as a result of vitamin C, but we'll talk about it. So modalities of treatment include nutritional supplementation for dry age-related macular degeneration. And then for the wet type, there are all sorts of ways to treat it. I won't go too much into that because it's not my area of expertise. But in addition to nutrition supplementation, there are things like photocoagulation and photodynamic therapy and certain medications. So that's what macular degeneration looks like. Dry, you can see there is generally patchy degeneration of the retina. And then wet, there is hemorrhage or bleeding under the retina. So for the guests, we just want to let you know about some great nutrition supplements that we have. But before I get there, I want to caution everybody that please ensure that your lifestyle is well ordered and disciplined, because you cannot supplement or medicate away bad habits. That is a general rule. So whenever we ask, what do I give for this? What do I give for that? This person has this condition. Please ensure that lifestyle and everything about that person is well ordered first. Malnutrition is increasingly manifesting from infancy to old age. And the reasons are some of these, such as the food being highly processed. We don't do enough exercise, physical activity. There's also a link with underactive thyroid function and other hormonal imbalances. I touched on estrogens, progesterone and testosterone. Really a minefield when it comes to lifestyle. And then there's also a proven link to exposure to toxins. So can you see that the eye, which is the window of our soul, has to really be looked after? And as regards processed foods and sugar, this is what happens. Hormonal imbalances happen. For example, insulin that we tackled last week can be totally out of balance. They also deplete the immune system because they compete with vitamin C and other nutrients. And I suspect, as I've just mentioned, that that could be one of the reasons to develop macular degeneration. And then those processed foods and sugar corrode the inside of blood vessels and damage that damage sets up future cardiovascular diseases. If you think about it, it's actually quite, one needs to use your imagination, but think about it carefully. If the inside of a blood vessel is damaged, then that sets up an inflammation and thickening and deposition of a lot of cholesterol, and it might be the reason that those blood vessels get blocked also in the eye. And then there's a depletion of the body's collagen. Collagen is the structural protein throughout our body. It is also required in the eye to keep it intact. And this can lead to rapid aging and damage throughout the body, but particularly the eyes that we are talking about today. So it stands to reason that it becomes very, very important to control blood sugar. And so we are beginning to introduce some of our supplements that we have, because once out of control blood sugar happens, cataracts will form. But other things that we've just mentioned can also happen. So this is for the guests. This is what we are supposed to be living as. We are supposed to be doing lots of physical activity. We are supposed to manage our weight, and then we are supposed to limit our fats and sugars, and then eat optimal amounts of whole grain, which is very, very difficult, fruits and vegetables and protein. But the reality is that we are eating way too much fats and sugars, and hence the deposition of plaque and those other things that can happen into our eyes, arcus senilis, as a result of too much cholesterol. And we are hardly doing any physical activity, and we've pointed out that that is important, okay? So introducing the reason that our health needs to be turned around for our eyes to also be functioning properly. We don't want to remain too long in the tired and sick zones. We can try and swing this curve back up to become energetic so that we don't lose out on too much life and we don't depend on too much medication for years and years and years. We've agreed that that might be unsafe for the eyes. So we want to bring back whole grain oils. Those are the ones that were processed out of foods when industrialization began, and we don't get them in our diet. And yet they're so crucial for the functioning of our cells. Our cells are supposed to be healthy, allowing nutrients in and waste matter out. Instead, we are having a lot of unhealthy cells. And if you can think about the eye as an organ that is very delicate and very, very specialized, highly specialized and intricate, then it is crucial to start right here so that there is improvement in nutrients as well as energy. It's a very energetic organ. All these things we learn from our scientists. We have a scientific advisory board, and I believe that is the most treasured difference between this company and all the other companies combined, because their ethic is that all our nutrients that we get, our supplements, are based in nature and backed by science. And so there they are. It was started by Dr. Arthur First in the 70s. And the concept of core nutrition should answer the question about where to begin, whatever you're talking about, including the eyes. But we will talk about other things to add, but core nutrition involves these nutrients. There's the threonine that I've talked about, very, very important, the grain oils. Then omega-3 for eye health. We talked about dry eye and the fact that it's a clear sign of omega-3 deficiency. And then antioxidants are required, and vitamins and minerals. And then we need to keep blood sugar under control. So part of the core nutrition are the amino acids, but they are formulated with the right amount of fat, the right amount of carbohydrate, and vitamins and minerals, so that the blood sugar is kept under control. Now, let's look at some targeted solutions. But always we start with core and then we move on to targeted solutions. Start with Pro Vitality. It is a targeted solution in its own right, but you might need extra omega-3. I would highly recommend that. And then you could use an extra 1 or 2 threonines. And then phytonutrients for healthy eyes are totally important. The two that are talked about in this slide are carotenoid complex and flavonoid. Again, you can add extra, and I'm just about to explain why. Let's go back to age-related macular degeneration. The macula is the point on the retina where light focuses with greatest intensity. And over there is where carotenoids are concentrated by the body. If you have enough carotenoids on board, which is very difficult, by the way, out of an ordinary diet without supplementation, then whatever little bit is available will be concentrated there in order to protect that area where light focuses with greatest intensity. And so it becomes important to take consistently some carotenoids, and these two that are mentioned here, lutein and zeaxanthin, have been shown by many, many studies to be protective and might even attempt to reduce and reverse macular degeneration. So highest levels of lutein and zeaxanthin intake have been associated with 75% reduction in the risk of developing age-related macular degeneration. That is such good news for people who have been suffering with eye problems. Here is an answer. However, the key is consistency. So let's connect some more dots. In cruciferous vegetables, which are found in the pack that we call Phytodefense, they are found in a supplement that we have called Cruciferous Plus. Otherwise, naturally, you get them in broccoli, cabbage, cauliflower, Brussels sprouts, and vegetables of that nature. Mustard, yeah. Sulforaphane, found in cruciferous vegetables, also protect the retina. And then we've already talked about omega-3, we've talked about zinc, vitamin C, and vitamin E, flavonoids. All those will protect against the wet form of macular degeneration. Why? Because they strengthen blood vessels. Exactly what I said. I made an analogy, or I likened it to scurvy, which is leakiness of blood vessels. I believe that's what it is, just given a different name. Same underlying pathology, but a different specific name. So key to supplying nutrients is the ability to utilize the nutrients. Inadequate stomach acid interferes with utilization of several nutrients and may be an underlying issue in many cases of age-related macular degeneration. And that's why I would like to recommend the value of consistent supplementation in the diet. And now that we talk about inadequate stomach acid, some of you who are listening may know the product called lipotropic adjunct. It has in it betaine hydrochloride, which can help to boost the production of stomach acid. So it's a very good product. Other vitamin Bs as well. So talking about it, whole food vitamins, we've mentioned vitamin C, which prevents buildup of sorbitol and therefore can halt or reverse, or at least prevent formation of cataracts. Then vitamin B complex, it contains various constituents in there that are very useful for the eye. And then because the eye has a large quantity of unsaturated fats, a generous intake of antioxidants is essential. Deterioration of eye health can be prevented, ladies and gentlemen, otherwise delayed by wise dietary choices. And that's why we do what we do in this family. That's why we have what we've got. Then I want to mention this humble supplement. It's not very expensive either, and yet it is totally powerful. Vitamin A and D, if you can get your hands on it, it's a very, very good supplement. We have vitamin D as vegan D. I know you can use both of them quite well, but here it is for the vitamin A that I want to talk about this product. Um, the retina consists, as we pointed out earlier, of rods and cones. Rods at the periphery are for poor light vision. They contain visual purple, which is derived from vitamin A. So anybody whom you know who says they have a problem driving at night because of night blindness, that is a clear sign of vitamin A deficiency. And you could actually help them a lot by suggesting that they get vitamin A from you. Right, minerals, very important. We've mentioned them, zinc and others like magnesium. And it is important to regularly detox. We continue to hope that everything in the detox program will return, but in the meantime, we do have, we can get access to garlic, stage 6, beta guard, and then other things like minerals and fiber. Now, a presentation wouldn't be complete if we don't talk about eliminating toxins in your environment. Please, that is important. And I've talked about hormonal imbalances that may affect eyes and eye health. Ours are not hormone disrupting, so we recommend that you change to these ones as well. And finally, the eyes shout what the lips fear to say. So said William Henry. So look after your eyes well, because your eyes show the strength of your soul, said Paulo Coelho. I think his name is, I don't know how to pronounce it, Coelho. Right, thank you, ladies and gentlemen. I shall stop sharing. And you are welcome to